Hello everyone, I'm Dr. Augustine Mutudu from Medsafe Hospital. I'm here to talk about sickle cell disease. Sickle cell disease is a group of inherited blood disorders caused by an abnormal hemoglobin S resulting from a point mutation, resulting in substitution of valine for glutamine. This takes place during organ formation and it is inherited. Sickle cell presents in different forms. We have what we call sickle cell anemia, which is the commonest, and we have sickle cell trait, where these ones are called carriers. You will never know that you are sickle cell positive until you do a test. Sickle cell presents in different forms. However, the commonest forms are three. We have what we call vaso-occlusive crisis. This one is a painful crisis. Someone will always come when they are in pain, so painful, and it comes as a result of occlusion of the sickled hemoglobin within the blood vessels. This is because when there is sickle cell and there is a decrease in oxygen tension, the hemoglobin changes shape and becomes sickled. So when it becomes sickled, it occludes within the blood vessel and cut off blood supply. So when blood supply is cut off, the other part becomes infected. So blood will not flow that side. This person will always feel a lot of pain. So this happens due especially in coldness, when there is dehydration, and when someone has an infection. This is how this crisis happens, and it is the commonest. The second presentation, how these people come, will be anemia. Anemia comes as a result of hemolysis of the red blood cells. Because these sickled red blood cells are fragile, they easily break. So the continuous breaking of the red blood cells presents with hemolysis, and this person comes with darker urine. The other one is called sequestration, and this happens in the spleen. The red blood cells are trapped in the spleen. Hence the spleen enlarges and it becomes painful. Also the liver enlarges a bit and becomes painful. And these are the commonest presentation of sickle cell. The other one is parvovirus B19, which is the causative agent and is called aplastic anemia. Sickle cell is a multi-organ disease, so it affects all the organs of the body. Someone will present with heart failure. Ogenda olaba omwana nga tassa bulungi, omutima gukuba buli kaseera. They present with pneumonia. In male, they always present with priapism. This is a constant or painful erection, chronic erection. Omwana abeera mu bulumi buli kaseera. Omwana ow'obuwala tagenda alwawo okugenda mu nsonga ze ez'ekikyala. Omwana abeeraawo nga omutwe guzimbye, gye bayita bolting of the skull. Amagulu and amagumba gabeera gabaluma, especially batera ofuna amabwa ku bigere, batera ofuna amagumba amanafu gye bayita osteomyelitis buli kaseera ng'olya joints zimuluma. Abamu amaaso gaziba bayita blindness. Batera ofuna stroke olw'okuba nti red blood cells zino we zigenda mu busiwa obutini zibeera blocked, ekitegeeza nti omusaayi teguyita ne gugenda ku side eri endala ne babeera ne stroke. Tulina gye bayita fracture of the neck of the femur. Era abasinga obawulira nga bagamba bagenda kunnongoosa bagenda kunongosa kuba hip joint yakoze eki yamenyese naye nga lwaki olwokuba nti omusaayi tegumala ogugendayo tegumala batera ofuna vascular necrosis of the hip joint. So tubayambye tutya gye bayita comprehensive care of sickle cell. This involves screening, prevention and treatment of sickle cell. We have the screening. How do you do the screening? You do a sickling test. This sickling test will help you to know whether you have sickle cell or you don't have sickle cell. However, it is not a definitive investigation for sickle cell. So you have to do the HB electrophoresis. This one will give you all the traits of sickle cell. It will tell you whether you are a carrier or you are a sickler. And we encourage everyone, those ones who are preparing for marriage, before you go for marriage, please do the HB electrophoresis. If you really know that you are a carrier, please, if you are a carrier and also your partner is a carrier, discuss about it while knowing that the repercussions or the future outcome will always have a sickler. 95% is that you will always have a sickler. So we encourage the people who are preparing for marriage, always do the HB electrophoresis. If your colleague is a carrier, please discuss about it for us, see or you don't get the outcomes of these other things. We do always give them daily pain IV up to the age of 5. So when you have a child who is sickler, you give pain IV, you give them daily folic acid. Abamu babeera ne sickle cell anemia, so tulina tubawo omusaayi obayambako okuraisinga HB above 10. We prevent malaria because malaria will always worsen sickle cell. Abaana bano babageme vaccination with PCV and Haemophilus influenza. Give them supplements like multivitamins, give vitamins B6, give them hydroxyurea from 9 months. Hydroxyurea abayamba nnyo obutabeera nga buli kaseera bali mu ddwaliro. It reduces actually 95% of the admissions. It also helps them not to always have the crisis, and hydroxyurea also helps them reduce on the chances of blood transfusion. Esembayo is always reproductive counseling. In reproductive counseling, always have a reproductive plan. Wabanga ogenda nga weteesetese kuba n'abalwadde ba sickle cell ba carriers, oba weetegekera okufuna olubuto, always test before marriage. Obanga ogenda kufuna olubuto olina obeera nga olekera okumira hydroxyurea 3 months before a woman gets pregnant. Olwokuba nti omira hydroxyurea ate nga ogenda kufuna olubuto, aba ajja kukosa omwana ono ali mu lubuto. So byebyo ebimu bye tulina okukola ki? Okwetegekategeka nga tonafuna lubuto. So bannange nga mmaliriza, sickle cell bulwadde gye buli, bulwadde butambuli tubufuna nga maama ne taata ba carriers, taata carrier, maama carrier, oba nga nze ndi sikira nefuna omukyala nga naye sikira. Bulwadde buli inherited, kitegeeza nti buli inborn era ng'osobola busobola okutambuzibwa from generation to generation. Omwana ono asobola okufuna n'abaana bozadde ne babeera nabo paka, naye nga bwe tuba nga twekebeza tusobola okukola ki? Obukendeeza. So bannange mbakubiriza mujje wano ku Medsafe tubakebere sickle cell nga tonakola ki? Tonagenda mu bufumbo. Mbeyanziza mwebale.